For joining us virtually, and Dr. Morikawa will discuss his abstract, a phase 2 study of lung cancer gene panel testing using cytological specimens.
Thank you for your introduction, Dr. Naidu. My name is Kei Morikawa from St. Marian University School of Medicine. I will share the presentation. Okay. Okay, let's start. This is my presentation. I will talk about the prospective validation study of lung cancer gene panel testing using cytological specimen. There's no disclosure. And multi-panel CDX is very important for precision medicine. Currently, tissue biopsy is considered to be a best choice for multi-panel CDX assay because tissue biopsy can get sufficient histological and genetic information. However, in the tissue biopsy is invasive and sometimes not enough for gene panel testing. Of course, liquid biopsy is an alternative non-invasive approach for panel assay, but the problem is the detection sensitivity decreases. We thought that cytology samples could be a promising backup for multi-CDX panel assay to fill these gaps. Cytology sample collection is generally less invasive compared to tissue biopsy, and diagnosis sometimes could be done by cytology samples alone. Cytology sample collection may have a good balance of less invasiveness and high detection sensitivity. These 4 cases show the tissue biopsy samples could not be corrected under these situations like pleural massive effusion, mucinous subtypes invasion, and bronchial or tracheal stenotic change by the tumor. It's very hard to take tissue samples because the forceps could not open in the axis bronchus. But these 4 cases detected driver mutation by cytological specimen. We need highly sensitive NGS assay to apply cytological specimens to panel tests. We consider the application of lung cancer compact panel, LCCP, invented by Dr. Kato and NAIST in Japan. The analytical performance of the panel has been validated using 1,600 clinical FFP samples of Dr. Higashiyama's institution, OIST, and described in this research paper. The compact panel has been developed based on the research by the Japanese company DNA Chip Research Incorporated. And in the last year, this product was submitted for regulatory approval in Japan as multi-CDX panel assay of NSCLC. Compact panel focuses on the lung cancer driver genes, 8 druggable genes as listed here, features as compact design, highly sensitive, highly accurate, and high success rate compared to the other CDX. We validated clinical utility of the compact panel for cytology samples. We use some cytological specimens collected by transbronchial brushing, TBNA needle washing, and pleural effusion. The malignant cells were confirmed by Rose procedure or paired sample, which are divided by original container and sequentially evaluated cytologically. Cytological samples were directly stirred to the GM tube, which contains nucleic acid protective agent. No centrifugation or freezing required. So very easy for sample storage and shipping, the turnaround time is very short, especially when using loss procedure. We conducted a single-center prospective study from 2 years ago to collect and analyze cytology samples. The primary endpoint of this study is success rate of LCCP analysis using cytological specimen. Secondary endpoint is mutation core profiling using LCCP and concordance with CDX. Nucleus is extracted from cytological specimen, and comparison between LCCP test result using cytological specimen and FAP tissue sample with gene R frequency. In 255 prospectively enrolled cases, 163 cases were cytopathologically confirmed adenocarcinoma and conducted LCCP analysis. This slide shows patient characteristics. Most cases were advanced stage, and samples were collected mainly using bronchoscopy. We defined assay success criteria as follows. According to this definition, all samples, all 163 samples were successfully analyzed using LCCP. And LCCP showed a high concordance mutation core to other CDX with 99.5%. Sufficient nucleic acid yield is obtained regardless of the examination method, and the DNA integrity number and RNA integrity number values, which indicate the quality of nucleic acids, was very high. This pie chart showed that LCCP detected gene mutations in approximately 17% of patients with adenocarcinoma. This figure shows that the concordance of variant R frequency in cytology and tissue sample was very high. This study has just been accepted in the Cancer Journal, and so please refer to it. And please feel free to contact us about the technical aspect of this procedure. And this research is currently undergoing multi-center trials in Japan, and LCCP might be used for clinical practice as a new CDX kit in our country within this year. Thank you for listening.